Today we are talking about a rare blood vessel disorder that can lead to stroke, aneurysm. It even has the potential to be fatal. Dr. Josh Abecassis is an expert on what's called Moyamoya disease. I know this is probably the first time many of you are actually hearing about this. What can you tell us about it?
So Moyamoya means puff of smoke in Japanese, and that's the typical patient that we usually see affected with it. It's basically a narrowing of usually both carotid arteries on the inside of the skull, so not in the neck where other people can get narrowing, and patients can have strokes or bleeds. In response to the arteries closing down, the base of the brain sprouts kind of small friable blood vessels that give the appearance of a puff of smoke if you do an angiogram. And so in Kentucky and in the United States, we see a kind of a variant called Moyamoya syndrome, which is usually due to other reasons, atherosclerosis on the inside, radiation, et cetera. So that's the disease.
Okay, so let's talk prevention. Are there any preventative measures for this?
Not really. Unfortunately, with a lack of blood flow to the brain, we don't have a really good medication that can treat it, and that's why it's sort of exciting for surgeons in that, you know, there's surgery is sort of the best treatment that we can offer. So the risk of having a stroke with just medical management, which is really just taking an aspirin a day, is about 20% over 10 years. And we can cut that in half by offering a surgery in most cases.
Well, we know that U of L Health has a really unique program, the only one in the state that's actually working on this. Tell us a little bit about that.
So we have a brain bypass program, and the goal, there's a couple of things that we strive to do. So number one, we try to educate patients on all of the possible conditions, Moyamoya syndrome, Moyamoya disease, other steno-occlusive or narrowing disorders in the brain. Number two, we try to do a full diagnostic workup. So we do a diagnostic angiogram where we get really good pictures of the blood vessels and how flow to the brain looks. We get an MRI, we do a CT perfusion with and without diamox. And then we discuss all of these cases with neurology, with anesthesiology, with neuropsychologists, which usually evaluate most of the patients. So it's really an interdisciplinary, comprehensive program aimed to help the community at large. And then finally, we offer a treatment. And so we're one of the only places in the state and the region that offer direct bypass for Moyamoya syndrome and disease. So, you know, it's sort of a full circle, starting with education of the patient and going through the workup and then offering all the treatment options that are available. We also work up and treat other narrowings that might present like Moyamoya. So if there's a narrowing in the neck, like carotid stenosis, we can, you know, cut the plaque out surgically or put a stent in. And so we run through all of the diseases that can cause the same syndromes.
Wow, and quite the team working there behind it. Thank you so much for taking time out of your busy schedule to come on and talk to us today. We really appreciate it.
You're welcome.